Leonardo DiCaprio, a name synonymous with talent, heartthrobs, and an incredible acting range. But is his seemingly ageless face all natural, or is there a surgeon's skill involved? Let's investigate. In 1993, at the age of 19, Leo has a widow's peak. He also has a strong anterior temple point. He has relatively high brows with some degree of arching. When I look at his nose, Leo has tip bulbosity and he has some dorsal convexity, which is the shape of the nose that you can see from a 3/4 view or the side profile, where there's essentially a bump on the nose, but it looks like the bump is a bit lower than where the bones are, so it's primarily cartilaginous in nature. Leo also has a strong jawline. In 1994, at the age of 20, what I'm seeing here is some congenital dermatochalasis, which is excess upper eyelid skin, and he has more of it on the right side than the left side. And related to that, there's reduced supratarsal show, and you can see that more on the right side, where the supratarsal crease is essentially hidden by that excess skin coming down. In 1995, at the age of 21, what I'm noticing is that Leo's left eyebrow is higher than his right. He has natural under eye hollowing, and he has a relatively short philtrum with prominent upper tooth show. We have a video on the channel where we went around New York City looking at billboards, and what we found is that there's this common feature of short philtrums. Take a look at that video. In 1997, at the age of 23, this was the year of the Titanic movie. And what I see are some signs of a potential rhinoplasty, specifically that the tip has been refined. Remember that there are different ways of doing rhinoplasty surgery. Specifically, there's an open approach and a closed approach to how you access the cartilage and the bone of the nose. Many celebrities look to avoid any type of external scar, so they often opt for a closed approach. With a closed approach, the incisions are all made on the inside of the nose. You don't get an exterior scar right at the base of the nose. Despite some of these changes to the tip of Leo's nose, there's still some semblance of his prior nose. There is still some bulbosity present, so it doesn't deviate too far from where he started. There are different ways to adjust the cartilages of the tip of the nose. Most often, a small amount of the cartilage is removed to take away some of its curvature so that it flattens out. There are more extreme forms of that procedure where you can actually reconstruct the entire lateral crura of the tip of the nose, and that's sometimes done, but in Leo's case I think that was not done, and I think he had a more minor adjustment to those tip cartilages. I think if you're looking to stay natural, it's important to be conservative when it comes to adjusting the nose in general, but specifically the tip cartilages. Because once you make more aggressive changes to the nasal cartilages, you run the risk of causing different breathing problems or just changing the aesthetics of the nose to the point where things start to look very different than where you started. In 1998, at the age of 24, I wanted to go back to rhinoplasty surgery because there is a recovery process to it. Usually it takes more than a year to see your final results. And what I think we're seeing here with Leo is that there's further shrink wrapping of his nasal skin envelope as time has passed and as more recovery has taken place. Skin envelope healing can be somewhat unpredictable. No matter how successful the surgery is, you can't fully control how the skin envelope contracts back down to fit the underlying structure that you've created on the inside. And you'll see a longer recovery the more thick your skin is. Some people ask, how can you tell how thick my skin is without doing the surgery? Well, I look at the ala of the nose, and that gives me some guidance as to how thick the skin is. The thinner the ala, which are the wings of the nose, the thinner the skin envelope likely is. The thicker it is and the more rounded it is, usually that means that the skin is going to be thicker. And you can use that to guide the discussion of how long one's recovery might be after a nasal surgery. In Leo's case, I think that the ala are moderate thickness. So I think that his recovery time is somewhere in the range of a year to a year and a half for full recovery, specifically when it comes to the swelling aspect after a rhinoplasty. In 2001, at the age of 27, you can see that Leo's eyebrows have started to descend. And this is something that happens as we age. Usually in our late 20s into our 30s, that's when we start to see this process taking place. In 2002, at the age of 28, there's more recession and thinning of his hairline compared to 9 years prior. You can see that the right side is recessed more than the left, and this is the case in about 90% of people. No one exactly knows why, but it's something that I've experienced in my practice as well. A good way to stabilize your hair and prevent further loss is with the use of finasteride, which blocks the conversion of testosterone to dihydrotestosterone, which is the more potent form of testosterone and which causes miniaturization of our hair in the DHT sensitive zone. To obtain finasteride, check out feelconfident.com. It gives you the ability to get these hair medications delivered directly to your door at lower prices than the competition. I'm also seeing that now that Leo's eyebrows are lower, the upper eyelid dermatochalasis is more enhanced. You can see that now the left side supratarsal show has been reduced. In 2003, at the age of 29, I wanted to point out the lower eyelid orbicularis oculi prominence, and this is caused by the use of those muscles over time, causing some degree of hypertrophy. When it comes to the orbicularis oculi muscle, there are different portions of it. There's a palpebral portion, which is more on the inside of the muscle, and then there's the orbital segment of it. In this case, the hypertrophy that we're seeing is because of the palpebral portion of the muscle. On the contrary, when people are getting Botox for crow's feet wrinkles, they're actually getting that Botox placed into the orbital portion of the orbicularis oculi muscle. That orbital portion is fairly superficial to the skin surface, and it's a relatively thin muscle. So if you inject the Botox too deep, you can actually affect some of the smiling muscles deeper in the face, and that can change the smile. And that's a complication that's sometimes seen with crow's feet Botox. In 2004, at the age of 30, what I'm seeing here is that Leo has these forehead rhytids that are becoming more static, and that's what occurs over time. As you start to get these lines and creases in the face, they become more etched in, and that's the difference between static and dynamic wrinkles. Dynamic wrinkles my 4-year-old daughter has, and we all have. As we animate, you start to see these different creases forming, but the static ones are what occur over time as we age, and they're visible even at rest. And again, when it comes to Botox injections, the efficacy is much worse when you have very deep static wrinkles compared to when those wrinkles are just in their dynamic form. And also keep in mind that for men, Botox injections are usually required at higher doses to accomplish the same result compared to women. But just to reiterate, I don't believe that Leo has had Botox injections at this stage. In 2006, at the age of 32, there is slight facial weight gain that's specifically visible throughout the cheeks. In 2007, at the age of 33, we're beginning to see some slight submental fullness in Leo's neck, and the glabellar rhytids are becoming more prominent. In 2008, at the age of 34, I wanted to bring up the central mustache area. That's right at the Cupid's bow region. And what I see is that Leo has minimal hair growth in that area. And we see that commonly. Some people come to me wanting a hair transplant to improve the density of that region. But what we find is that the survival rates of the grafts are generally lower compared to other parts of the face and the scalp. And it's unclear exactly why that is, but my theory is that there's a watershed area there because the vasculature to that region of the central mustache comes in laterally from either side. So you have contributions off of the facial artery, such as the superior labial artery and the facial artery itself, that's giving blood supply to the area, but it comes in from the sides. So as you get to the center, there's a weaker blood supply there, and that is what is called a watershed zone. And that's why I think we most likely see this reduction in survivability of the grafts directly there. It doesn't mean that the grafts won't survive at all, there's just a lower chance of survival in that zone. In 2009, at the age of 35, I see no change, and that is the same through 2017. In 2018, at the age of 44, we're seeing continued gradual brow descent and upper eyelid hooding. The supratarsal crease is only partially visible now on both sides. In 2019, at the age of 45, there's a change to the cervicomental angle. And compare this to Leo at 25. It makes sense that over the course of 20 years, there's been some additional fullness added here, and that changes the angulation of the cervicomental angle. And this is due to a combination of fat that exists in the deep platysmal space or subplatysmal area, and the supraplatysmal space, which is the area between the platysma muscle and the skin surface. Keep in mind that procedures such as liposuction, cool sculpting, and kybella only target the supraplatysmal space, or the area that's in front of the platysma muscle, which is more superficial. It doesn't get to the deep areas. In order to get to those deeper fat deposits, you would need to do surgery for access. In 2020, at the age of 46, I'm noticing that there's a more prominent frontal scalp to temporal scalp transition. And this occurs as the temples start to thin out over time. Some people start to get fillers into the temples to adjust for that thinning, but you need to be careful not to lateralize the face too much in that area. In 2021, at the age of 47, I'm seeing that Leo has increased lower face and neck laxity, and that's a very normal occurrence for someone in their late 40s. In 2022, at the age of 48, there continue to be some weight fluctuations, but I don't see any obvious signs of filler injections. In 2023, at the age of 48, in addition to the wrinkles that he has in the forehead and the glabellar area, there are now some more prominent wrinkles seen in the crow's feet region, and the total cost of his potential procedures is $20,000. Since you like this video on Leonardo DiCaprio, check out this celebrity transformation video. Make sure to subscribe with post notifications on so that you don't miss a future upload.